Okay, it's 11 o'clock by my watch, so we're going to get started with the main event here. I just want to cover a little bit of housekeeping for today's webinar. First of all, some of you may have noticed we have a slight change in presenters this morning, and our center director, Dr. Deanna Helsher, will be standing in for Dr. Shreela Sharma, who can't be with us today due to a last-minute conflict. Next, I'll answer the single most popular question we get for all of our webinars, and that is, yes, we are recording this webinar, and we will make the archive and PDF of the presentation slides available on our center's website at msdcenter.org and our YouTube channel later this week. A link to the archive and presentation slides will be emailed to all of today's registrants and attendees as well. We do want to hear questions from you today, and you can type those in using the questions box on your GoToWebinar control panel. You're encouraged to type in your questions at any time, but to keep us on schedule, we'll hold off on answering those until the Q&A portion at the end of the webinar. Next, I'd like to thank our partners in hosting the Child Health and the 84th Texas Legislature webinar series, and that's Live Smart Texas Coalition and the Partnership for a Healthy Texas. You can learn more about these organizations and their membership on their respective websites, livesmarttexas.org and partnershipforahealthytexas.org. Now I'd like to tell you a little about the Michael and Susan Dell Center for Healthy Living. We are an international leader in conducting research and providing programs that promote healthy living for children, their families, and communities. Our mission is to advance health and healthy living for children and families through innovative research, cutting-edge community-based programs, and dissemination of evidence-based practices. Our vision is healthy children in a healthy world. You can find out more about our work on our website at www.msdcenter.org. And now, I'd like to introduce our fantastic guest speakers for today. First, Celia Cole is the Chief Executive Officer with Feeding Texas, formerly known as the Texas Food Bank Network. The mission of Feeding Texas is to lead a unified effort for a hunger-free Texas. They move millions of hungry Texans toward food security through a statewide network of food banks, strengthen the collective response to hunger through collaboration and scaling success, and lead the public conversation needed to solve hunger in Texas. Celia Cole is an expert in food and nutrition policy with experience at the state and federal level. Prior to Feeding Texas, Celia was a senior policy analyst with the Center for Public Policy Priorities for 14 years, where she covered food and nutrition, welfare, and family economic security issues. She also has worked in a policy capacity with the Texas Department of Human Services and for Laurel Consulting Group, a private consulting firm in Washington, D.C. Celia serves on the advisory committee of the Partnership for a Healthy Texas and the Texas Food Policy Roundtable, and is actively involved as a board member of her local YMCA. Celia holds a bachelor's degree in art history from Columbia University and a master's degree from the Institute of Latin American Studies at UT Austin. Dr. Deanna Helsher is the director of the Michael and Susan Dell Center for Healthy Living and the John P. McGovern Professor in Health Promotion here at the UT School of Public Health Austin Regional Campus. Dr. Helsher's research interests are in the design, implementation, and evaluation of programs, policies, and measurement tools related to child nutrition and physical activity. She's been recognized by state, national, and international organizations for her expertise in child nutrition and obesity research. Dr. Helsher is the former president of the International Society for Behavioral Nutrition and Physical Activity and served on the Institute of Medicine Committee on Evaluating Obesity Prevention Efforts, a plan for measuring success. She's currently working on projects to document the dissemination of the CATCH program across Texas, evaluate the efforts of nutrition and physical activity policies on child health, and to elucidate the interactions between genetic factors and dietary behaviors. Truly a great set of guest speakers today, and with that, I would like to hand it over to Celia Cole, who's going to kick us off here. So Celia? And Celia, you might be on mute because we're not hearing you yet.
My apologies. I guess you all didn't hear me say good morning. Can you all hear me?
So, good morning. Got you now. And good morning.
Thank you for that kind introduction, Brooks, and it's an honor to be here today. And I want to welcome you all to the Feeding with Impact webinar. So what I'm going to present today is a strategy that we share with the Partnership for a Healthy Texas called Feeding with Impact, which is a comprehensive approach to tackle childhood eating and childhood obesity, and move the needle on healthy eating. Next slide. Before I talk about Feeding with Impact, I want to introduce you all to our network and talk a little bit about what food banks do. For those of you not familiar with Feeding Texas, formerly the Texas Food Bank Network, we are the state association representing a network of 21 member food banks across the state. One of the things I like about this map that you're looking at, beyond its being colorful, is that it immediately shows you that we are truly a statewide network. Each of those blocks of color represents a food bank and its service area. And so what you can see is that we provide services in every single county of the state. So when we bring a public health solution like Feeding with Impact to the table and to state legislators, we are bringing a statewide solution that can be implemented in every county of the state. Next slide. So our 21 member food banks provide food and other services through a network of about 3,000 partner agencies. About half of the agencies we serve are faith-based. We run services through churches, food pantries, soup kitchens, but we also serve a lot of organizations who aren't exclusively working to provide hunger relief, but can provide a broader array of services. We focus on children's centers, senior centers, and we do a lot of work with local schools. So our partners are very diverse, and where we don't have a bricks and mortar partner agency, we manage to find other solutions, creative solutions to getting food and services out to those communities, whether that's through mobile feeding trucks or partnering with locations in the community where we can set up a food pantry that we then take down afterwards. So we do manage to reach every single county of the state that way. Last year, we distributed collectively as a network 378 million pounds of food, which is enough for about 315 million meals. Now, most people, when they think of a food bank, they think of a big warehouse that hands out a lot of cans and boxes. And while we do indeed distribute a lot of food like that, one of the things people don't realize about Texas food banks is that about 30% of our distribution is fresh produce, and we distributed 109 million pounds of produce last year. But in addition to distributing food, our food banks provide a broad array of other services that are really designed to go beyond hunger relief and focus on the issues that lead people to need our services in the first place, whether that's unemployment or barriers to employment, and thinking about services that can help people address those upstream issues in the hopes that we can not only feed the line, but shorten the line at our agencies. And then we also focus on providing services that help people deal with the consequences of food insecurity. There's a growing body of research that links food insecurity to poor nutritional outcomes. And that's because we know that even when people aren't outright starving or going hungry, that the inconsistent resources to afford food, the worry about being able to afford food, the inability to always have enough resources to buy nutritious food is directly linked to poor dietary outcomes and increased diet-related illness and obesity. So in addition to feeding the hungry, we really want to nourish them and combine our food distribution with other services that can really help people make changes in their immediate eating habits, their purchasing habits, and learn how to purchase food on a budget, with the end goal being to reduce diet-related illness, improve their overall nutritional health, and reduce obesity rates. Next slide. Which brings me to Feeding with Impact, which is what we call this approach to going beyond hunger and really combining our healthy food distribution with education and interventions that are evidence-based approaches to changing the way people eat. So we have one big goal for this legislative session that we share with the Partnership for a Healthy Texas that I'm going to talk a little bit more about today. We're seeking $20 million for the next biennium from the legislature to increase produce distribution and scale our Feeding with Impact programs. We have numerous models that are working at the local level at all of our food banks, but all of them rely on produce distribution, free produce distribution to the people served in those programs to work. And so in order to scale them, we need to significantly increase those funds from the legislature for produce. So as I said earlier, we are offering a comprehensive approach to tackling childhood obesity and move the needle on healthy eating across the state. Next slide. So a little bit of history on the funds that we get from the legislature to source donations of fresh produce. Back in 2001, the legislature established a grant program whose official name is the Surplus Agricultural Product Grant, and whose nickname is Texans Feeding Texans, which is how most people know about it locally. The funding has grown from an initial appropriation of $300,000 in 2001 to $2.9 million in the last legislative session. And what we use these funds for is we pass them through to our 21 food banks, and it helps them offset the cost of farmers donating Texas-grown surplus or unsellable produce. So it's either food that can't be sold because there's a surplus, or it's food that is perfectly edible but maybe has a little bruise or is the wrong size, and therefore it's unsellable but perfectly good for donations. And the funds offer up to 10 cents per pound to the donor to cover costs related with harvesting food, packaging it, storing it, or transporting it. Now, originally, when we sought funding from the legislature back in 2001, we presented the program, as one focused on providing an outlet for surplus agriculture and therefore benefiting Texas farmers and growers, and as a means to get nutritious food to healthy families. But the way we originally created the program, it didn't include specific goals related to using produce to improve health outcomes. And that's what we're working on doing today with the Feeding with Impact strategy. Next slide. So it's pretty simple. We combine free produce distribution with evidence-based programs to increase food access and food literacy and improve health outcomes for low-income Texans. And what we hope we're offering to the state of Texas is at least part of the solution to the big public health crisis the state is facing relating to childhood and adult obesity. We know that treating people with diet-related illness, treating obesity, comes at a huge cost to the state. We hope by expanding our produce distribution and scaling evidence-based models to move the needle on healthy eating, that we can make a serious dent in the obesity problem facing the state. And we want to do this by expanding programs like Brighter Bites and other successful interventions that our food banks are using. And I'm going to mention just a few of them because our focus today in this webinar is on Brighter Bites, but it's only one of many programs that are already being used at our food banks that we will be looking to scale with an increase in funding to source produce. I want to highlight the work that's being done at the San Antonio Food Bank with a program called Bienestar. And they offer healthy eating classes using that curricula that essentially focus on, in a number of different areas relating to improving the way people eat and the way people think about eating. It focuses on dietary quality, healthy cooking, food safety, and food budgeting. And they offer that program not just in schools, but throughout their wide, diverse range of partner agencies. Our food bank in Austin, the Capital Area Food Bank, has an excellent program called Choices Nutrition Education that also helps individuals and families make smart choices at mealtime. That program is funded through the federal funding for SNAP education, which focuses on people who are eligible for SNAP or food stamps or on that program to make healthy food choices within a limited budget. That program is also increasingly focused on obesity intervention. And then I want to highlight a program at the Food Bank of Corpus Christi, another award-winning food bank for nutrition education that's called Diabetes Hands-On. And this is a program that is that they're implementing in Corpus Christi as part of a national initiative to combine healthy food with education, lifestyle, and food choices education, as well as testing other medical interventions designed to help people stay on top of their diabetes and help them manage it. So we really offer a range of programs that fit the Feeding with Impact model. And as I said earlier, the expansion of those programs is very dependent on our ability to increase funding to source fresh produce and be able to take those programs to scale. So that said, I'm going to turn over the floor or the mic to Dr. Helscher. Thank you.
Thank you, Celia. That was really a nice overview of Feeding Texas and the programs that y'all are engaged in. So now I'm going to change the focus to Brighter Bites and talk about this program and how it's been implemented in Houston and Dallas. So Brighter Bites is the vision of Lisa Healthman, who's in Houston, and she had participated in a weekly fruit and vegetable co-op or community-supported agriculture group in which she got a box of fresh produce weekly. And what she found is that through looking at what was in her box and learning how to cook it with different recipes, that her own children started making healthier choices. And they started enjoying different types of produce than she might have bought on her own if she had just gone to the grocery store. So Lisa thought, if this works in my home, why couldn't it be replicated for families who don't necessarily have the same access to fresh produce? And so therein began Brighter Bites. So the plan of this, Lisa went about this very purposefully. So one of the things she wanted to do was to bring a food co-op to where children are already. So bring it to them. So schools was the logical place rather than have them go to a separate place. Then not only do you want to provide food, but you also want to provide knowledge to the kids so that they'll eat it. You can give kids all the produce in the world, but if they're not aware of what it is and how to prepare it, and their families as well, then they're not likely to eat it. So you need the behaviorally based education in addition to environmentally supplying fruits and vegetables. And then in giving out this food, they wanted to provide a weekly fun food experience so that the kids would really have fun with it and think it's fun. Because if kids think it's fun, then they're more likely to do it, and parents too. And then measure the outcomes. So really look at this as an evidence-based model in which you build the evidence for the program's success. So Lisa contacted many leaders to launch the program. So here at the Michael and Susan Dell Center for Healthy Living, she contacted Dr. Shreela Sharma, who's at the UT School of Public Health in Houston at our Houston campus. And so Shreela is an epidemiologist with expertise in behavioral science. And so she led the team for program development and evaluation. With schools, Brighter Bites worked with Mike Feinberg, who's founder of the KIPP Academies. And so he originally pledged a school that had a 93% reduced or free lunch program population. So this was a population that was already getting a federal meal program, engaged in the federal meal program, and there was a food desert in the area as well. So with the distributor, they worked together with the Houston Food Bank and Brian Green in particular to get the fresh produce. And then partners included the American Leadership Forum, medical class, and colleagues at Texas Children's Hospital. So they volunteered their expertise to formulate and support the program. So this program is implemented in 8-week increments. And so it's done 3 times a year, fall, spring, and summer. And 8 weeks is needed because you need to see that much implementation for impact. And so what this involves is produce distribution. So one of the things that happened was that parents received 50 plus servings of produce that were sent home with kids at no cost to their family. And so the 50 plus servings ended up being about 2 grocery bags filled with a balance and several seasonal fruits and vegetables. And so there's examples on the slide of different fruits and vegetables that were in there. So some were common to the families, such as potatoes, some maybe not so common, such as kale. So the 50 servings roughly equates to 2 servings of fruits and vegetables for a family of 4, so a mom and dad and 2 kids. And then by partnering with the food banks, they were able to obtain this at a reduced cost. And so the amount of food roughly equated to about 30 pounds. So for the second part, for the curriculum, there was a nutrition physical activity curriculum, and for that they used the Coordinated Approach to Child Health program, which is an evidence-based program that is run through the center here. And so CATCH has programs available for preschool through middle school as well as after-school programs. And so weekly nutrition education activities are built into it, as well as increased moderate to vigorous physical activity. So we have several studies showing the efficacy of CATCH in decreasing obesity prevalence, as well as increasing healthy eating and physical activity. The programs were available bilingually, because we know that in a lot of these areas we had Spanish-speaking population. So it was really important to have it in 2 languages. So the program handouts also included healthy recipe ideas for the produce there, as well as parent handbooks. And then there was a fun food experience. And so there were tastings of food. So we'll show that in just a little bit later. And then there were a lot of volunteers that were brought into the program that were needed to help bag up the produce and then produce the food and share it with the families. So it was a lot of excitement getting these free foods. So Brighter Bites, the strategies including partnering with schools and locations that provide this, and kind of start at a local level in the Houston area and then reach out nationwide. So right now, this program is kind of in the second phase. So it went from a Houston-only implementation to now being implemented in both Houston and Dallas, and also outside of schools into YMCAs and Head Starts. So currently there's 21 locations in Houston and 9 in Dallas. So the scaling has implemented from about 150 students to over 5,000 students. And not only that, but now Brighter Bites is also reaching the teachers and the school staff by providing them with fresh produce. So as part of this, CATCH is implemented in these elementary schools that distribute the produce, and this includes the CATCH curriculum, which are kindergarten through 5th grade curricula. There's also physical education equipment and activity boxes, as well as a CATCH coordination kit, which is annualized to have teachers and the school staff engage in every 6 weeks a new theme. So the CATCH trainings at these schools are coordinated with Brighter Bites, so that there's a lot of continual program support both ways. Brighter Bites also assists the school staff in identifying a school CATCH champion, having a campus CATCH committee, which we found to be associated with better implementation, implementing family fun nights, which may or may not be associated with Brighter Bites distribution as well. So this graph right here shows the increase in the number of families that are served weekly. So as you can see, with the increased funding from the Texas Department of Agriculture starting in the 2013-2014 school year, the number of families served weekly was able to increase quite a bit. And then the sites were able to increase as well, from 1 site to 29 sites this fall. So with this program, we really want to do a robust evaluation. So process evaluation and parent surveys have been collected every 8 weeks across all of the sites. So quite a bit of data now. Part of the evaluation also includes program cost data, and the outcomes evaluation is ongoing. So it won't be finished until May of next year. But for that evaluation, we have about 700 parent-child dyads at 12 school sites. So the outcomes that we're looking at include preferences and willingness to try fruits and vegetables, as well as increased consumption of fruits and vegetables, and increased parent confidence and skills to prepare fruits and vegetables, and then a decreased prevalence of overweight and obesity among children measured by BMI. Just a word about this. When you talk about providing fruits and vegetables to families in food deserts, a lot of times fruits and vegetables are seen as luxury items because they tend to go bad sometimes, especially if people don't know how to prepare them. So that's not often something that parents will buy, or it's hard to make a choice because it's between buying that or buying some food that is more shelf stable. So that's really an issue that comes up. So one of the things to look at this is to see, do you see a decrease in some of these packaged foods that tend to be a little bit more energy dense, and instead see parents opting more for fruits and vegetables. So the results from the 2013-2014 year show that at baseline, looking across 340 parent and child dyads, 42% of the study sample of kids in the first grade were overweight or obese. So this is much higher than the national average. We also saw that kids were consuming fewer servings of fruit and vegetables than recommended. So 1.3 servings of fruit and 0.6 servings of vegetables. And that's not including potatoes and French fries, which adds a little bit extra servings to that. And then they were only consuming about 0.5 servings of whole grain foods. So if you look at fruits and vegetables, a recommended amount of 5 servings of fruits and vegetables, you can see that they were way under where they should be. And kind of another fact that surprised us is about a quarter of their calories were coming from sugary beverages. So on the next slide, you see a little bit about what the parents were reporting that the kids consumed. So the parents reported that 89% of the vegetables in the bag that they were given were consumed by their children. So they ate all or most of the vegetables there. And as you can see, a very small percentage ate half or less than half. So that really is one of the things we want to encourage is kids have to try foods for an average of 8 to 15 times before it becomes part of their repertoire. Now, if you look at the fruits, the parents reported that 93% of the fruits, 93% of the kids ate all or most of the fruit that were there. And we know that kids tend to eat fruit a little bit better because it's sweeter. If you look at the effectiveness of the Brighter Bites program components, both in fall 2013 and spring 2014 at the bottom there, you can see that a majority of parents found that the program components reported that they were effective, and this percentage went up in spring, probably because they had been in the program a longer period of time. So these are kind of exciting data to us too. The parents reported that when they participated in Brighter Bites, that 98% of them noticed an increase in the amount of fruits and vegetables that their family ate. And not only did they eat more at that time, but then 74% said that their family was able to maintain that level of fruit and vegetable intake after the program ended. So that's really what you want, is sustainability of these behaviors. Another one of the results that we found was that the cost of produce per family per week was actually relatively low, the cost to the program. However, what we found is that the families reported saving $40 in the fall and $33 in the spring on their grocery bill. So they actually were using the fruit and vegetables there to replace some or all of the foods that they had eaten. So here are a few parent testimonials, and these are just really exciting and kind of fun to read. One of them said, Brighter Bites is an excellent program because it reaches a lot of people. It definitely served my family, so my kids will like more fruits and vegetables. Another parent said, the program is awesome because it's nice to help and be helped at the same time. With the fresh produce I receive, I can cook for my whole family and everyone is happy. Another mom said, I really like the program because it helped me to show my kids and whole family how to eat a more balanced diet. And then finally, and this is one of my favorites, is we can't wait for you to come back so we can try more new things. So at the event where they give the fruits and vegetables, you can see a lot of new recipes are tried at that time. So the kids get so excited. You can see a smoothie being prepared there. There are green kale smoothies. The kids love those. Muffins, a variety of salads. The kids love to eat them. The parents love to eat them and try them. And then they're so excited because they can go home and replicate these recipes in their own kitchens. Now, the distribution relies on a lot of volunteers, and here you can see some of the volunteers as well as some of the kids with their Brighter Bites bags and how excited they are. At the bottom, you can see them trying their kale smoothies, and they've got smiles on their faces. So in conclusion, what we've seen is Brighter Bites has shown some significant increases in acceptability and in the distribution of produce to families. We're really excited to see what the evaluation data will show in May in terms of intake of fruits and vegetables and the effects on obesity and overweight. And so here's a shout out to the rest of the Brighter Bites team, Lisa Helfman, Shreela Sharma, and Christine Markham, who are the investigative team. And then there's a Houston team and Dallas team that have managed the program and coordinated it. And Mike Pomeroy is actually on the webinar today, so he'll be able to kind of help us with any questions that anyone might have. And then finally, I'd like to acknowledge the partners, including funding that was obtained through Texas Department of Agriculture, HEB, Blue Cross Blue Shield, and then collaboration with the North Texas Food Bank and Houston Food Bank, as well as our center. And then the website, brighterbites.org, www.brighterbites.org is at the bottom of the page. And so now I'll turn it over to Brooks.
All right. Well, thank you all so much for fantastic presentations. I just want to let everyone know we welcome your questions at this point. So you've got a questions box on your screen there, and you can just type them in, and we will do our best to answer here. We've already got one in now from Jessica. It says, does the parent have to be present for the child to receive the produce, talking about Brighter Bites, and how are parent-child pairs asked to participate?
Mike, do you want to
Let's see if we can unmute Mike here. Sorry. Mike, are you there and can you hear us?
Yes, here I am.
All right, we've got you.
To answer that question, we really do want that touch point with families, with the parents and children. They're asked to come in to pick up their bags, and that's when they get that fun food experience. They get to taste the kale smoothie or what have you. And that's been an important thing to show. The children are often more brave than the parents, and they're getting their parents to try these things. And parents are often learning that their kids like things that they never thought they would like. So we invite them to come in, and we do want to have that touch point with the parents. And as far as signing parents up within a school, once we coordinate with the school leaders, we send out forms to the participating grades and to all the parents and invite everyone to participate. And they turn those forms in, and we just take care of the logistics from there on out.
Great. We got another question from Jessica that asks, what all occurs during school hours with Brighter Bites? And I think that's kind of a question about what Catch does that's kind of Brighter Bites centric, or is there anything different from normal Catch curriculum that goes on with the Brighter Bites program during the day?
The only thing during the day would be the bagging that we invite parents to come help with. The actual parents who are taking the produce home, we get them to come up and help, and that's often during the school day in the cafeteria. But as far as the programming with the children, yes, it's just the Catch. It's the implementing the Catch curriculum throughout the campus.
And I might want to add to that is with Catch, foods are structured in go, slow, and whoa foods. And so fruits and vegetables, fresh fruits and vegetables all belong in the go list. So it's when you prepare them with a lot of butter or fry them that they move to slow or whoa foods. So really that's emphasized. There's pictures of fruits and vegetables as go foods, and there's several activities where kids choose fruits and vegetables. So this is a perfect companion to what's being taught in the curriculum.
Great. And I've got a question here for Celia too. You mentioned the ask that you guys are putting in for the next legislative session. Can you talk a little bit about what those costs entail, how large the spread is that you guys would like to do, and who is really getting this money? How are you guys passing that through?
Can you hear me?
Yes, we can hear you.
Okay, great. Sorry, I was on speaker in multiple places. I'm sorry, mute. Yeah, so the way the grant works, or has always worked, is the funding goes to us through TDA, the Texas Department of Agriculture. So it's a grant program, a 2-year grant program, and we have a contract with them to administer those funds. We then allocate those funds out to all of our 21 food banks based on their total pound annual distribution of food, a share of the whole network distribution. So they each get their share based on how much food they're putting out as a percentage of the total. So we basically set up a virtual account for those funds, and then they can order produce directly or accept offers directly from donors, and then we reimburse the donor for the cost of the donation. So as I mentioned earlier, the funds can be used to provide up to 10 cents per pound for harvesting costs, for storage costs, for packaging costs, and for transportation. So for example, a donor in the Valley might say, I've got some tomatoes that I can't sell, or they're slightly bruised, and I'd like to make that donation. Can you help me offset some of the costs of making that donation? And our food bank in the Valley then can draw down the funds from the TDA grant to offset that cost. And so, with the 2.9 million last session, really is, when you think about 21 food banks and the 3.5 million clients we serve and the number of people and communities that we need to reach, it's not a lot of money once you divide it up. And then when you look at the hundreds of millions of pounds of surplus that's going to waste every year that we're not capturing, we really want to be doing a whole lot more to take advantage of those opportunities. So the $20 million that we're seeking this session was really based on a calculation analysis of how much surplus is out there, and then our network capacity to accept that. So we didn't want to ask for more than we could handle. And so of the 20 million, 18 million would go to provide increased funds out to our food banks to help them source those donations of produce. And then 2 million would be used to continue to expand the Brighter Bites program in Houston and Dallas, as well as begin to implement it in some of our other food banks.
Great. And this is all local Texas farmers and grocery stores that you're talking about, correct?
Yeah, the way the grant funds right now are restricted to Texas grown produce.
Great. We've got a couple other programs about Brighter Bites. It looks like a lot of people are interested in getting it in their community and when it's coming. Nancy Britton's asking, when is San Antonio going to try Brighter Bites? Mike, do you know of any expansion plans that are in the works or ways that this might be getting expanded in the future?
I think it's just dependent on the same thing Celia is talking about. With additional funding, we'd be happy to spread.
Yeah, let me answer that too. So, Brighter Bites is the expansion of Brighter Bites is dependent on the food bank in the area having the produce to be able to donate to the program. So the way we keep the costs low with Brighter Bites and make sure that it's successful is to have the food bank donate the produce to the program. And I think it's, I don't want to misspeak, but I think it's 30 servings per family per week. And that's a lot of product, and it's also the way the program is designed. It wants to bring not just 1 or 2 varieties of fruits and vegetables, but to really have an array and a diversity. And so for our food banks to be able to do that, they in turn need to have the funds to source those donations, which is why the legislative funding, the state funds, are so critical. So the programs really work in tandem with each other. Simply providing more administrative dollars to expand Brighter Bites won't succeed unless the food bank that's partnering with it has the funds to source the produce. Now, in terms of expansion plans, we definitely want to continue to expand it in Houston and in Dallas. We are looking at expanding it to the Capital Area Food Bank potentially this year. San Antonio is another area where we think it would be a very successful program. We've talked with our food bank in Wichita Falls about the possibility of taking it there to test how it works in an area that, because there's not a lot of produce grown locally, it might struggle to provide the variety. So we really want to see if it's a program that we can make work in every community. We don't have a specific expansion plan yet because, like I said earlier, it's really dependent on us being able to significantly increase the support we get from the legislature for the produce piece.
One of the parts I think that's so interesting about this program, and I think relevant to our state, is that we're able to use Texas produce. So I come from a farming community, and so I've seen firsthand how a lot of times the produce can't be used. So this is really a win-win for almost everybody involved.
Yeah, I think this is absolutely fantastic, and I'm so glad that we had you guys as guests today to tell us all about this program. And it looks like we're running about out of time, so I'm going to go ahead and wrap it up here. But just wanted to let everyone know that this webinar was recorded, and it's going to be online on our YouTube channel. You'll get a direct link to it sent to your email for all attendees and registrants today. We hope you'll share it far and wide. But thank you again for attending, and we look forward to seeing you at the next Child Health in the 84th Texas Legislature webinar series. Thanks so much again, Celia and Mike and Dr. Helsher.